Welcome to 27 Topics. With us today we have Lynette Owen, a registered nurse at Memorial Hospital, and also Heidi Arehart, registered nurse at Memorial Hospital. And they're here this morning to talk about Parish Faith Community Nursing. And Lynette, could you give us a little overview of the program?
Sure, Paul, and thanks for having us back again
to
talk about Faith Community Nursing. Basically, Parish Faith Community Nursing, a registered nurse usually contacts me because I happen to be the coordinator at Memorial Hospital, or I'm out there promoting the program. Been a nurse within the church who generally has heard about it by now, or because it's becoming more and more popular. It's one of the 14 disciplines of being a registered nurse. There's many out there, and it can be a surgical nurse or an OB nurse. But now what we're wanting to do out in the churches is to do preventative health care and wellness. And so we encourage them to take some continuing education through some certification courses, which are all over the country, and we have one here locally. And once they do that, then we mentor with them to help them get going, a health ministry program going within their church.
I noticed you have with you a list which is too long to mention all of them here, but you have 20 or 30 churches already in the area that are involved in the program? That's
correct. We have 28 churches that practice health ministry in the area, and that's in Spencer County, Du Bois County, we got some in Martin County, Davis County. There's a few counties in the Memorial target area that we're still trying to expand our outreach. But we actually have 28 practicing churches and 38 trained nurses, because you don't have to have just one nurse within your church. Actually, we encourage that we will even see that they maybe get funded for the course to train one nurse per church per year.
Heidi Arehart's with you?
Yes.
And she's a nurse at the hospital and also a parish nurse. Heidi, how did you learn about this, and how did you get started?
I originally heard about parish nursing when my husband and I lived in Denver. There was a newspaper article, and at the time I was a hospital nurse, and thought that's something I would be interested in, but I was new to Denver and I didn't see any resources to get the training there. We then moved to Nebraska, and again there was another newspaper article in Nebraska, and I thought at that time I was in a different position in life, and I thought that's something that I would like to do. That would be an area of nursing I'd be interested in going into, but there were no training opportunities in Nebraska either. And when we moved here to Indiana, I met Lynette, and she said, "Oh, by the way, did you know that there is a parish nurse training course? Would you be interested?" And I really saw it as an answer from God, because it was an opportunity that I had nowhere else, but I had this interest. And it was kind of an extra bonus, I think, for moving to Indiana, was to be able to take this course and go into this field.
Well, it's interesting, you are a registered nurse, mm-hmm. and that you are, willing to work in a volunteer program.
Yes, and that's
in your church.
Yes, that's all I do at this point. I have 2 young children, and so I don't work actively in the hospital right now. I fill in my husband's office occasionally as a nurse, but otherwise I spend a lot of time every week doing parish nursing within our church with members of our congregation.
And we understand, it's been almost, I guess, a year ago when we talked about the program, mm-hmm. and we had with us Mrs. Rashi from St. Joseph Church, which is a large congregation. And then your church is a little smaller church. Can you tell us how it affects the smaller church?
It is. Our church is approximately between 130 and 150 people, mostly younger people. When we first approached my pastor about the parish nurse program, his initial reaction was, well, we don't have very many older people in the congregation. I don't think we really need this resource. But after talking to Lynette and going over things, he fully came in line with backing this me as a nurse and is excited about it because I go in and do education programs regarding health and wellness and things that the younger families can apply to their lives. And we do have a few older people, but it's not just older people. There's a lot of programs that we can offer to the congregation that will benefit them, whatever, age their family is at that time. We offer CPR classes and things like that to just make them more aware of wellness.
So it's interesting that you have a younger congregation, and so how has the younger congregation responded to the needs?
We have approached it as, America has the issues with being overweight, a sedentary lifestyle. And so when I presented it to the congregation, I presented it as we, as Christians and in a congregation, God challenges us to be fit, working towards the kingdom and running for the goal and all of this stuff. And we talk about how God wants us to take care of our bodies because it's the temple of the Holy Spirit. And so I used it as a way of motivating them to make healthy decisions. Last year we did the Heart Healthy class, and we had 20 participants in that class. We've offered CPR classes. We're currently doing a weight management program that's Christ-centered, and we have very good response from the congregation. They've been, I think, motivated to step up and make changes in their life because people realize that they need to make changes. It's just hard to do it if you don't have support.
Are these, the churches have blood draw? Is this through this faith-based initiative that these are held in the different communities?
When you ask blood draw, are you talking about for the American Red Cross? I know at our church, I run the blood bank for blood donation twice a year, my husband and I. So the health ministry program actually runs that whole thing.
Oh, okay.
Calling volunteers and that kind of thing. Now, in her program that she talked about, A Heart Healthy Way to Joyous Living, that's actually a sponsored program, again, through Memorial Hospital's health ministry program. And I come in as the coordinator, and it's a design program for 6 weeks. And it's sponsored through the Welborn Baptist Foundation. And the initial time that what she did was actually recruit people to take the course for 6 weeks. And then I came in and we did a blood screening. And then we would give them the results. And what we're looking for, of course, is what are your cholesterols? What are your blood sugars? Here's your weight in relation to your height. And these are some things that you might want to look at. And then for the next 6 weeks, they come in every week. They have a design program where the first week we talk about spirituality and health. What does actually the Bible say about taking care of our bodies? And then the second week, they talk about exercise. We have a joint thing with the YMCA. They do things for us and we do things for them, and that's one of the things they come and give the exercise talk. Third week's a nutrition talk. And all these talks are given by experts from the hospital, dietitian. Fourth week, we talk about hypertension, one of the leading causes of cardiovascular disease. The fourth week is diabetes, and the last week is stress. So, and then we don't just drop them after that 6 weeks. We come back in 6 months, and then a year we rescreen them, and then we tell the nurse,
Yes. And
take over.
I do monthly blood pressure screenings after our Sunday services once a month, and most of my participants are probably in their 30s and 40s because that's when the high blood pressure is showing up in members and people in general just because of our lifestyles. And so it's making them aware that you have these risk factors, or you're doing fine with what you're doing, your blood pressure's good, keep doing what you're doing.
The thing about it is, in the times that we have just currently, stress is probably more evident
Yeah, biggie.
in these times.
It is.
For what you're doing, so you probably see a little bit more than you do. What I think we have coming up earlier on, Lynette, you mentioned a class, an education program.
That's
for
correct.
Persons or nurses interested in being involved in the faith-based nursing and health ministry program. what are some of the responsibilities of the parish faith community of nurses? What we mentioned some of the things that you do in your church, Heidi, and what are some of the responsibilities for people that may want to consider the program?
Well, it's a 35 CEU course, or continuing education course, and some of the, I call them the building blocks of parish nursing. If you could, take concrete blocks and you're stacking them, this is the things that we teach them. Integrator of faith and health. And we just talked about that in a heart healthy way to joyous living, that we're trying to combine faith and health and how those two are interchanged. A counselor. There are many times parishioners will call us and ask us questions, or what can they do to maneuver through the healthcare system, or something was said to them at the physician's office and they have no idea. We're health educators. We try to be referral agents when it's appropriate. We're coordinator of volunteers. We may get another, an example that we have at Shiloh is something called MOPS, Mothers of Preschoolers, and they meet twice a month. And, I've been to their meetings a couple of times, worked very closely with them when the MOPS got started years ago, but now don't really have to do that because they have volunteers to do their program. We're developer of support groups. We're also a health advocate. Again, how do you maneuver through that difficult healthcare system this day and age? And those actually, every one of those that I named is actually a module. So that's some of the things that they learn. And again, there's so much more to it because documentation, or how do you keep your ministry going? If the first thing a church will ask most of the time is, we don't have any money for that. And we tell them, it's okay. We don't need a lot of money, or we'll find the resources to add this ministry to the church. Nurses are very resourceful, problem solvers. We learned early on in our healthcare career, give us a problem and we got to make a diagnosis and we've got to figure out the outcome. So parish nursing is perfect for us because, again, we want to be those problem solvers. I think, again, I want to bring Heidi back into this, and health educator or counselor. Again, there's so much going on about that. There could be an epidemic outbreak. And what is the first thing that you need to learn in an epidemic outbreak is wash your hands. A lot of people wash their hands, but do they do it long enough? So Heidi has even extended her ministry outside of her church. She went into the school system up in Du Bois and taught.
I taught
kindergarten
through fourth grade how to wash their hands the proper way, and we used the substance called glow germ that they sprinkled on their hands, and they got to shake each other's hands and see how germs are spread using a black light. And it was very popular with the kids, and we talked about you need to wash your hands for 20 seconds, and make sure there's lots of bubbles to get all the germs off and everything, just to help prevent colds and infections from spreading within the classroom. And hopefully they'll take that knowledge back to their parents and talk about, Mom, I learned this is how we need to really be washing our hands. We can't just splash them under the water and be done with it. So we've worked with the community on that.
Again, that's that faith and health thing. 20 seconds, say a prayer or sing a song, come up with something, and you'll be there long enough.
And doing it in the schools with the kids, the glow probably was really.
Oh, they thought that was pretty dramatic. They like that stuff because it shines neon, almost neon with that, and they can see. Because when we tossed a ball around that had the glow germ stuff on it, and you can see when we shine the light, some of the kids, in the meantime, had rubbed their nose or rubbed their eyes, and so then they have these germs on their face, and they were pretty intrigued by that.
Wash your hands.
Yeah.
Wash your hands.
So.
It's just one way of faith community nurse teaching. I do it at our fall festival for our kids at Shiloh. We have a big fall festival in October. So we look for many opportunities, again, to integrate faith and health and be that health educator.
And in the other area that I have seen for health advocate is so many families are spread apart where their children are out of state or out of town, and people who have doctor appointments or are diagnosed with a cancer or diagnosed with a serious illness, I will go with them to doctor's appointments if they don't have family members in town. I will try to help them understand what's going on so that we can coordinate and get them, because that's a very stressful time, to just bring them so that they know they're not alone within the system. We're here to provide support.
Move on to the next item. Do you want to talk about the program at this time? Why don't you tell us about the program that's scheduled for the Cordis Retreat Center?
Okay. The basic parish nurse or faith community nursing education program is coming up Wednesday, September the 24th, and it's from Wednesday to Sunday, and it's through the University of Southern Indiana in cooperation with the Tri-State Parish Nursing Organization. And to get registered, all they would have to do, if it's a registered nurse that would be interested in starting a program within her faith community, or if there's anybody out there within the faith community and this sounds like a program that might fit within your church organization, talk to your pastor or your minister or priest and have them to call me, Lynette Owen, at 812-481-8438. And I'll come out and talk to you, or we can arrange a time that's convenient. And I'd like to share about parish nursing or faith community nursing with you. This is an international, parish nursing is international. It's all over the world. And we're fortunate enough to have a course close. We're having it at Ferdinand, even though the University of Southern Indiana sponsors it. We bring all the educators up here. Their meals are included. They can spend the night. The cost of the course is $550, but there is funding available for those who qualify through the Welborn Baptist Foundation, because they have a specific area within their funding that's designated just for health ministry, and that's been one of the things that's been so ideal and fortunate for us here in Du Bois County, and really was the underlying root of our program. The Welborn Baptist Foundation has funded for the past 5 years now Memorial Hospital's Parish Nurse Network. I write for grants, and we put I have that money, and that's how I can do a Heart Healthy Way to Joyous Living. But they also have money set aside, again, for nurses to take this course. And I've got the numbers totaled up in my office, and I think there's somewhere they've given us around $13,000 to educate these 30-something nurses. So we're very appreciative to them for what they do.
Yes, and I would like to say, I know when I first read about parish nursing, I thought it was maybe just a Catholic thing because it said parish and all that stuff. And then when I heard about the Welborn Baptist Foundation, I thought, well, maybe it's just for Baptist. But at the seminar that I went to, the program I went to, there were nurses from the Assembly of God Church, Methodist Church, Catholic churches, Lutheran churches, Presbyterian churches, non-denominational churches. And so this is a good faith-based nursing that can fit any faith-based community within the church.
Yes, just by the name of it, faith-based community can be, any church community.
Yes.
That's correct. It's very ecumenical, and it's designed that way. And one of the biggest driving forces, again, for parish nursing or faith community nursing is something called Healthy People 2010, which is a government program. And, this has been going on, actually, if you go back and look through history for the last 20 years. I think it started out as like Healthy People 2000 back in the early 1990s. And now, of course, they've shifted to 2010, and I'm sure they will extend it to 2020. But there's things that the government says that we need to be looking at. And so this really opened the door again for faith community nursing. And one of them is physical activity and overweight and obesity. And again, I'm going to go back to here in our area, we're fortunate enough to have for the past 3 years a Heart Healthy Way to Joyous Living to put out there in the churches. And people feel more comfortable doing a program in their, within their church. I mean, what's really nice is sometimes they knew those individuals, but over the next 6 weeks while doing that program, they really get to form this cohesive group and, build their relationships within their congregation.
That's the nice thing, because a lot of churches, people go in Sunday morning and they leave after church, and then they don't talk to anyone else within the church. And this gives them a chance to form those relationships.
Yeah. And you're usually available probably after church or after the service or whatever it is.
Yes.
With what's really usually most parish nurses are probably available 24/7. I mean, they get to know who we are, and I don't want to give you the impression they're calling us at home, because I get very few calls. But when I think the church learns to feel comfortable enough with you that if they need you, they know how to get a hold of you and ask you those questions that you are able to answer when in regards to health care. A couple other things that we bring to light during the course is Covered the Uninsured. There's a week in May called Covered the Uninsured because there's 47 million Americans without health insurance. The faith-based community, which again is part of Parish Nursing Health Ministry, we're very aware of that. And so what can we do to address those disparities? And how can we help individuals maybe maneuver through the system again? If I get questions about, well, I don't have insurance, I don't know what to do, there's an individual at our hospital that's a claimant. Her name is Lisa, and if they'll call me, I give them her number, and they can talk to her about their health, and maybe she can help them through the Indiana program get, some kind of coverage. Health literacy, again. A lot of times we'll walk into the healthcare system and things are said, or tests are even repeated because an individual says they're not sure. Well, they ran that, but I'm not really. So sometimes we need to teach people to be more responsible. Ask questions. If you don't understand, please ask your physician, or if you're medications this day and age. I mean, I always say millions. As a nurse, sometimes I'm even frantic because I don't volunteer. I actually still get back in the hospital and do nursing care, hands-on nursing care, because sometimes I miss it. But the medication thing, and these little, elderly, the generation, and us baby boomers, how can we, take more responsibility for our health care?
In your conversation here, you mentioned the Tri-State Parish Nursing Organization. And is that how through the Wellborn grant program works of the entire Tri-State?
Yes, the Wellborn Baptist Foundation actually covers 11 counties. They have one in Kentucky, 3 in Illinois, and the rest are located in Indiana. And what they did when they became a foundation, they looked at the service area that they had covered while they were a hospital. And the Tri-State Parish Nursing Organization came into existence in 1994. And at that time, it was just a way that, again, to pull those nurses that were out there doing things in their church together a couple of times. We actually meet 4 times a year and do, and we'll go to, we'll go to something like in a church, and have like the Diabetes Association come in and talk to us. And they, the last time we had her, she brought us monitors to hand out in our churches, and she told us why they've tightened up the glucose levels, which, as a nurse, if I'm not out there practicing all the time, and it's because of your eyes are affected at a very low blood, like at a 124 blood sugar. You're starting to see deterioration in your eyes. So we try to always do continuing education. And actually, besides what you get at the basic parish nurse course, now there's some advanced modules that are coming out of St. Louis, which is the International Parish Resource Center that holds the educational modules. And we're looking at very seriously, well, how do we start having these advanced modules? And we had the first group in March, 2 of the advanced modules. And we're looking at, well, over the next couple of years, how do we integrate those extra 20 modules within for continuing education? And you asked about the Tri-State Parish Nursing Organization. I happen to be the chairperson of that. So we're just an identity by itself. But the Wellborn Foundation also supports us, and USI, and it's kind of a collaborative triangle thing. And again, Memorial Hospital and Healthcare Center has benefited greatly. And we're the only hospital in the tri-state area that actually has a hospital-based parish nurse network. So there's 4 different modules of parish nursing that we call it: volunteer in the church, paid in the church, volunteer with a hospital network, or paid within a hospital network. So we've kind of got a little of both here.
It's and overall, as chairperson of the Tri-State Parish Nursing Organization, I mean, I'm sure they all function well, but with the tied into the hospital like we are here, do you see different functions in the parish when they're differently associated? Like here we are with Memorial Hospital, which makes us kind of feel good because of you're associated with a hospital while we're doing this.
I do know that I do think having a hospital-based network is an advantage because, again, if you look at the list of parish nurses within our organization, 90% of them work full-time at the hospital. So if they're wanting to do programming at their church or they need information for their church to do some kind of program, they'll call me and I'll get that together for them. And I'll just deliver it, and they have to do very little work in doing a presentation. Like maybe they want to teach on cancer awareness, and I have poster boards and bulletin boards prepared for those kind of things. And they can pick them up. Or if they want to teach CPR, I have CPR equipment that was also we got through a fund from the Toyota manufacturing. So, and that is an advantage. In Evansville, the Tri-State Parish Nursing Organization really don't own educational things. So the churches will get together as a group. And actually there is a group of churches now, like on the west side of Evansville, looking at how can we form a cohesive group and call us something different so that things are available to us and we can teach it again ecumenically instead of being, separated. So
it works. One of the ways that the churches within Huntingburg and Jasper and some of the other areas around here is, I had a patient in our church who needed some medical equipment just temporarily because of an injury. So I called Lynette, and Lynette said, if you call such and such a church, they have loaner medical equipment. And I was able to get a walker for this person on loan because they didn't need it. They didn't want to pay for it that way. And so I was able to say, or crutches or, different things like that for just temporarily. And then that was, for people who don't have a lot of money, that saves them money. So
and those are, it's great to have that service available for people. And a lot of them probably don't really, unless it be for you, would not know that that's available.
Correct.
And so that's really another example.
Right. Yeah, we're always looking at how can we save the healthcare dollar. Again, I just recently had an accident in our family, and our son broke his foot. He needed crutches, and they said we went to the Huntingburg urgent care, and they said, well, we can give him crutches. I go, no, that's okay. I'll go get them at my church, because they're available for us to be able to use those kind of things.
A lot of people do not realize that. I tell you what, we just have a couple of minutes left. Would you like to go through the it's a retreat setting educational class that is going to be at the Cordis Retreat Center in Ferdinand?
Yes, I would. Again, it's called the Basic Parish Faith Community Educational Nurse Program. It starts on Wednesday, September the 24th through Sunday the 28th. The registration actually is right on this brochure. We also work very closely with the Welborn Baptist Foundation, and there's a possibility that if you're a registered nurse or if your church is interested and you have a registered nurse that you'd like to get started on this program in doing health ministry within your church, there's funds available for her to be the church be reimbursed for 2/3 of the cost, and the cost is $550. I'd appreciate it if you'd contact me, Lynette Owen. Again, I'm the parish nurse coordinator at Memorial Hospital and Healthcare Center. My number is 481-8438, and that rings directly in my office. And if I don't happen to be there, leave me a message. For those registered nurses, again, that might be interested, I think they'll find this very enjoyable. So,
is there a web page where the information might be available?
Yes, they could go to the University of Southern Indiana, and it's listed on their continuing education programs under nursing. They need to go under the nursing
and continuing education.
Right.
Will the nurses who want to take this program, it's $500. However, some of it could be reimbursed. Would they know that before they take the program?
Yes, they will, because I'll make that very clear. And there's if they are eligible for the funding, there's some additional paperwork that we need to take care of through the Welborn Baptist Foundation.
Very good. Heidi Arehart, registered nurse at Memorial Hospital, and Lynette Owen, registered nurse at Memorial Hospital. We want to thank you for being here this morning, bringing us up to date on faith-based parish nursing.
Thank you so much.
Thank you.
Thank you.